Hey everybody, Dr. Patel here. Sorry about the delay. Hope you all are doing well. Our usual 2 p.m. start time got moved to 2:30, and then I'm late for that too. So I apologize. But I hope you all are doing well this wonderful Friday afternoon, the first Friday before Thanksgiving. I can't believe time is flying so much. But we're going to continue on with discussions about hand and wrist conditions and talk now today about hand, wrist, thumb osteoarthritis. So if you like this video, please share it, like, subscribe, all that stuff. And if there are any questions that you have, you can feel free to comment, DM, or email us at info@fxregencenter.com. If you have any questions about this, or if you want me to talk about anything else, then feel free to let us know. Because we're always looking to things that I can talk about and help clear up some misinformation about and educate and all that fun stuff. So without further ado, let's talk about wrist arthritis. Previously we talked about things that can cause numbness, tingling into the hands. And the things that we talked about that can cause numbness, tingling into the hands can certainly also cause pain into the hands. So how do we know if our pain is associated with something like carpal tunnel versus things like arthritis? Well, typically I told you in our last discussions that carpal tunnel usually involves numbness, tingling, pain going into our fingers. Whereas while this is stuff that feels like it kind of radiates through the hand and through the fingers, arthritis typically involves specific joints. And arthritis, if you heard me talk about this in the past, arthritis is a wear and tear condition that does not necessarily equal pain. Really involves just gradual wear and tear of our joints, which are where one bone meets another bone. And this takes place gradually over time. That is called osteoarthritis. But there's another type of arthritis that also involves fingers and wrists and hand joints, and that's called rheumatoid arthritis. Rheumatoid arthritis is a systemic condition that can involve multiple joints throughout the body, and it very commonly can affect the joints of the fingers and wrists. Typically, when we first start feeling symptoms associated with rheumatoid arthritis and the digits, it oftentimes involves the parts of the hand that are further away, parts of the fingers that are further away, what are called the DIP or distal interphalangeal joint, or the PIP or proximal interphalangeal joint. Now, these joints start to get painful, start to get stiff, start to get swollen, and over time they can get really, really swollen and even have some soft tissue swelling that occurs as well. If you start noticing that you're having swelling in your fingers that's occurring across multiple fingers and that's unassociated with various different activities, then it might be worth it to see a rheumatologist, or at the very least your primary care doctor, to get some blood work done and to find out if you have any things or markers that are suggestive of rheumatoid arthritis or any of the other systemic arthritic conditions. This is important because if you do have something like rheumatoid arthritis, which again is an autoimmune condition that involves the whole body, this is an inflammatory condition that can cause joint issues to progress over time and can cause some permanent changes into the joints, what are called erosions. Erosions are when the bone at the joint actually starts to break down. And that's something that ends up being more serious and sometimes requires things like surgery. But oftentimes, if we catch issues like rheumatoid arthritis early enough, then getting on certain medications may be able to help that scenario quite a bit. But there's a difference between rheumatoid arthritis and the systemic autoimmune type of arthritis conditions versus things like osteoarthritis. Osteoarthritis typically involves one joint Sometimes it's more than one joint, but it's usually things that are associated with activity over time. The most common joint to develop osteoarthritis in the wrists and hands are actually the first part of the thumb joint, called the first CMC, or carpometacarpal joint. And this is the joint where the thumb meets the wrist, and it's a very, very common area for us to develop osteoarthritis. And that is predominantly because we have such mobile use of the thumb that there ends up being some gradual wear and tear over time. Now, osteoarthritis in general involves that excess mobility of a joint gradually wearing out the cartilage, or the smooth surface of the joint. Eventually, over time, the bone starting to get a little rougher, and eventually, over time, the bone getting bruised, and eventually breaking down. And that is the whole spectrum of osteoarthritis, which does not necessarily equal pain. Very common for us to have arthritis and have no pain associated with it. But we can have some stiffness that starts to get associated with our joints. We can have pain associated with the joints if we are not moving correctly. So if you take a joint that has osteoarthritis and then you're vigorously using your hands on a regular basis, then those joints can become painful. Another thing that contributes to osteoarthritis that I think is actually oftentimes overlooked is if we have too much mobility in a joint. When we think about osteoarthritis, we think about joints that lose mobility, that become stiff and become, rigid, that lose their ability to bend and rotate and things along those lines. And that is absolutely a part of osteoarthritis. But that actually is what takes place gradually over time and takes place later in osteoarthritis. But some theorize that the early stages of osteoarthritis actually have to do with increased mobility, or increased abnormal mobility particularly. So what do I mean by that? When we talk about the joint, any joint, has various different ligaments that surround it. Ligaments are the duct tape that connects bone to bone, and there are various different ligaments throughout the wrist region. And excuse me, these ligaments, as if you've heard me talk at all, these ligaments are the duct tape that connects bone to bone, but in actuality, these ligaments are like those thick rubber bands that surround broccoli in the grocery store. So what do these ligaments look like? Basically, we have tons of these guys attaching bone to bone throughout our wrist and thumb regions. So these are pictures of various different ligaments throughout the wrist. You can see that all of these various different bones have this little scotch tape that's attaching to it. Those are all the different ligaments throughout here. Now, as we are gradually using our hands over years, and we're moving our hands, doing a lot of things, some of those rubber bands can slowly get stretched. And again, because the thumb is opposable and has multiple directions of movement, you can imagine that that thumb can get the ligament stretched a little bit more over time. If you've ever fallen on your wrist or twisted your wrist funny and sprained your wrist, that's likely involving an irritation or an injury to ligament structures. Now, when that occurs, there's some more play that ends up going on within the joints. So imagine, again, those rubber bands getting stretched or getting little tears inside them. Those rubber bands are not going to be as strong. And such the thumbs or the joints start to move more. And with that increased friction, the cartilage starts to wear away. And with that increased friction, the bone is a living, breathing thing. The bone is actually smart. The bone in the joint is like, hey, there's a lot of movement going on here. I'm going to bulk up in order to try to provide stability that the ligaments are not providing. So the bone actually can bulk up and get thicker in areas, can form little spikes in other areas, which are called bone spurs. And these bone spurs ultimately occur because the bone is trying to provide stability where there is not. Gradually over time, as the bone starts to evolve and get even more bulkier, then the bone does end up providing stability and that is what results in a decreased range of motion. That's also what results in some thickening of our joints when we look at our arms in different positions. So you might have noticed in yourself or in others that the base of the thumb can start getting squared. That squaring of the thumb ends up being very visible and could be a prominent part of osteoarthritis. So an example of that is this. So when that thumb starts to kind of bulk up like that, this is still arguably still an early component of squaring, but this can get even more severe like this. And here we have some pretty severe squaring of that first CMC joint. We also have other stuff going on, including weakness of these muscles here also. But this is when the arthritis in the thumb joint starts to get more and more severe. You can also get these kind of bony changes taking place in other areas over time. Again, as the osteoarthritis progresses and the bone changes, then we can get some bony bulking of the other joints as well. And this is all a kind of part of that osteoarthritis spectrum. That being said, how do we treat this if we have it, and how do we prevent this from getting worse if we catch it early enough? Well, this comes down to what phase of arthritis are we dealing with? What level of arthritis are we dealing with? And are there symptoms associated with it? We can see some people that have some pretty severe arthritis and have no symptoms associated with it. Then, well, there's nothing to be done about it. Now, if we catch the arthritis early enough and we're starting to get some pain in some areas, the first and perhaps most important thing that I typically recommend to patients is getting the muscles moving correctly. If we're moving our hands in abnormal ways, then we're going to be gradually wearing away at the joint and making things worse. So physical therapy or occupational therapy, hand therapy, can be really beneficial at strengthening various muscles and making sure everything is moving correctly. Sometimes a brace could be beneficial. If you find that you're getting a little bit more pain with doing specific activities, wearing something like a wrist brace to keep the wrist in a good position, or a thumb brace, what's called a spica splint, that can keep that base of the thumb from moving too much, could actually be really beneficial for us to use while we're doing the activities that would otherwise aggravate those joints. Now, if we catch this pain early enough and we examine and we see that there's a component of something like laxity of those ligaments, then doing injection treatments such as prolotherapy or sugar water injections or PRP, platelet-rich plasma, these injections may actually be really beneficial at strengthening those ligament structures and improving some of the stability of the joint before it gets to the point that the bone needs to provide the stability itself. Because ultimately the name of the game is, how do we slow down the progress of osteoarthritis? We can't do anything to reverse osteoarthritis, especially once it gets bad, but we can certainly try to slow down the progress by strengthening the ligament structures, strengthening the muscles to prevent the bony changes from occurring in the first place. Along those lines is seeing, are there any other components that could be contributing to abnormal motion in the hand? So things like the carpal tunnel syndrome that we talked about previously, or the cubital tunnel syndrome, or irritation of the ulnar nerve across the elbow, or irritation to the nerves of the neck, or issues with the other muscles of the forearm, the elbow, the arm, etc. Dealing with the underlying issue to get the body moving correctly is the number one most important thing when we're starting to get early arthritis signs. But the other big thing on the conservative side is our nutrition, and you've heard me say this over and over again. But anti-inflammatory nutrition could be a game changer when it comes to osteoarthritis. And actually, there's some interesting research that really supports anti-inflammatory nutrition for rheumatoid arthritis and other systemic autoimmune arthritis conditions. There are some anti-inflammatory supplements that could certainly be beneficial as well. Not a lot of research, admittedly, not a lot of research for hands, but there is some research for knee osteoarthritis. And I'll tell you anecdotally, I've had patients find improvement of their joint osteoarthritis, their wrist and thumb osteoarthritis with anti-inflammatory supplements also. Now, as the osteoarthritis gets progressively worse, there are other options to consider. The most common thing is something like a steroid injection. So a cortisone injection into the thumb joint or into the wrist joints could calm down inflammation, decrease pain temporarily. But really the benefit of this only lasts anywhere between a few weeks and a few months. And it's during that window where we can really progress the exercise, strengthen the muscles to try to prevent the issue from recurring. But if the pain does recur, I definitely do not recommend cortisone injections to my patients, especially not repetitively, because cortisone can cause osteoarthritis to get worse. This has been shown repetitively in other joints in the research, but we've seen it anecdotally in patients with wrist arthritis as well. So repeating cortisone injections into a wrist joint, thumb joint, or other finger wrist joint would definitely be something that you should consider avoiding. Don't take this as medical advice. Take this as information to help guide, because we see this over and over again where symptoms get worse with inappropriate treatment. Now, if the pain is getting severe and function is significantly limited, there are surgical procedures that can be done. The joint can be cleaned out, which could potentially be a beneficial treatment, particularly as there's bone spurs and chips of bone or cartilage that are floating inside the joint. But it does run the risk of causing further laxity, and especially if laxity or looseness of the ligaments was the thing that caused the issue in the first place, we run the risk of just getting short-term benefit and then jumping back into the same ball of wax. But doing an arthroscopic clean out type surgery and then following up with an orthobiologic, such as using a patient's own PRP or bone marrow, might be an option to consider after we get rid of some of the mechanical stuff that's getting in the way of movement, protecting and improving the biology of the joint with a regenerative medicine treatment. There are some interesting surgeries such as for the thumb, which actually have remarkably good success rates. There's a surgery where they remove a piece of bone and they put a little coil of tendon that they get from elsewhere and put that into the area to kind of take up the space. They call that an anchovy, and that goes and takes up the space there. And apparently this surgery has a ridiculously long recovery that's very, very painful. However, it's something crazy like greater than 90% success rate with this surgery, which is pretty darn phenomenal. But if we are trying to avoid surgery and we have more significant osteoarthritis, things like using biologics, PRP, bone marrow, even adipose fat tissue, and we've seen some patients find benefit with these type of treatments. Or at least, if not avoiding surgery, at least pushing off the necessity for surgery if we're trying to push it off as long as possible. So a lot of different things to consider, but ultimately there's different types of arthritis that involve the wrists. Osteoarthritis or wear and tear is a very common thing that involves the wrists, the fingers, and especially the first base of the thumb joint. And trying to catch this stuff early is actually a really big deal. So getting the body moving correctly, having the right nutrition, all of these things can help prevent things from getting worse in the joints of the hand and wrist. And doing orthobiologic treatments can help provide stability and slow down the progress of the osteoarthritis. So that's really about it. I hope this was informative for you. If you liked it, again, please like, share, and subscribe. Again, if you have any questions, please feel free to DM, contact us via comment, text, email, all that kind of stuff. You can email us at info@fxregencenter.com or call us at 310-929-9790. And we're going to move on away from the upper limb, and I think we're going to move on to the hip or something starting next week. But let us know if there's any other topics that you want to discuss. And we're also excited to announce that our Newport Beach office is going to be close to completion now, and we're going to be starting to see patients there starting December. So we're still going to have our Arcadia location once a week here in Los Angeles, but we're going to move our permanent home to Newport Beach. So looking forward to seeing you there. I hope you all have a great weekend. Next week is Thanksgiving, so unfortunately I'm not going to see you then, but hoping you all have a very happy Thanksgiving, and we'll catch up on our Facebook Live after that. Talk to you soon.